I wanted to give you a tour of what these homes look like, what these homes that will be supporting, especially adults with disabilities, which is my home right here, as well as older adults. And right now in Pennsylvania, there are 22 of us getting started, which means that at least 10 consumers within these agencies will be allocated for adults with disabilities with autism. So at least 10 for each agency will be servicing adults with autism. So that's 220 right there in Pennsylvania that is servicing models like this. So I want to show you what this model looked like, as well as showing you what type of home this is, how it's not a group home, how it's focused on inclusion, how it's focusing on using their individual support plan and focusing on their goals, their work goals, their social interaction goals, and incorporating that all in one home. So let's take a tour. Let's, I guess, start out with the outside. It's a little rainy day, but that's all right. So this is right outside. This is West Philly. Okay. So there's a trolley that runs right along this street, which is awesome. Talk about wanting to focus on public transportation, and it's right outside my street and my door. So we have a nice patio. Okay, so you can have social interactions outside, leisure activities. There's a lot to focus on, and me as an occupational therapist, my mind is just like flowing with ideas. We try to create what's called a hub for our consumers. So for my adults with disabilities, especially autism, we're trying to, for each agency, have at least 3 to 5 homes that will provide affordable housing, because again, people are on the waiting list for years to have affordable housing. So this is the one home, okay, right here. Across the street and to the right, that's my second home. And then 2 doors down this way, that's my third home. So that's my hub. That's my community for connecting all of my consumers together and being able to provide a community out in the community, which is really cool. So this is the living room. So we can definitely have, for example, a pizza party to work on social interactions, and those services are reimbursed. So they're reimbursed through non-medical. And then you can incorporate medical when you want to provide direct occupational therapy, 24-hour care, medication management. Those are all medical services that I could add. This is not a 24-hour home, though. So this is a transition home. These consumers, they can dress themselves, they can bathe themselves, but when it comes to those higher level IADLs, financial management, meal planning, going out in the community, taking public transportation, they need my support and they need my staff to help them to learn those life skills. So yeah, we could do a pizza party here on Monday, and they're learning social skills, how to appropriately converse with one another. And then we have a beautiful, nice, clean kitchen. All right, so again, this house is like incredible. Let me take you upstairs to the second floor. So the second floor is what's going to be allocated for my consumers with disabilities. So this is called an inclusion home because we're focusing on work, social skills, all the goals that are in their ISP. So we don't want to, again, overcrowd them. This is about focusing on value-based care. So at most, we want to have 2 to 3 consumers in this 7-room home, which is like, wow, that's a lot of rooms. But let me talk to you about that. So here's room number 1. This is a studio. It's incredible. They have a bigger walk-in closet than I do. So beautiful, nice clean space, a nice beautiful bathroom. So this would be for one consumer. And again, they get affordable housing through this because us as the healthcare professional, we have this specialized service that we can provide affordable housing. Because again, thank goodness for dentists and Optonome, since I have that whole back office, I don't have to pay out other people for the back office. So this is how I'm able to literally provide affordable housing, because I'm not paying all these other people to do the back office. That is dentists, that is the whole Optonome. So I'm just going to show you the hallway here. Okay, so that is 2 more bedrooms and a bathroom. Currently that's being used right now. So like we stated on the call, there is a real estate investor that purchases these homes, because most of us healthcare professionals can't put a down payment on a home for our company. So I had a real estate investor purchase this property. All I did was say yay or nay to the decision. It's 10 minutes from my house. It's an amazing close proximity, so they're able to have that weekly healthcare professional coming out for non-medical needs. So that's another service that many support coordinators and families and consumers are looking for, to have a healthcare professional come out on a weekly basis for non-medical and medical services. So, which is like very impossible to find, non-medical services and a healthcare professional is coming out and is monitoring what the goals are for those non-medical services and help build them. So that's just very cool. Again, because when Optonome is your whole back office, you save a lot. So you are able to provide these niche services because Optonome gets you qualified, and Optonome is your back office. Here is room upstairs. Look at that nice balcony. I opened it up yesterday. It was so pretty. So this floor is going to be the Airbnb model, okay? So why Airbnb? Because it focuses on the consumer's ISP goals. So their goal is to find a job. So we're able to provide them with hospitality services that they can learn within their own home. That's incredible. So you're able to provide work opportunities within their own home, social interactions. Like if their goal is that they want to live on their own with support, then they need to learn how to interact with these people, when they come out of their room, what's an appropriate conversation to do. And if they don't know that, that's why they're here. They're here to learn these skills through me, the healthcare professional, as well as the DSPs, the direct support professionals that provide that skill training that they need in order to learn these skills. So here is the second room upstairs, okay? So again, another Airbnb for this house, and then there is another room right here. These rooms are so cute. Okay, so that's another room, and then of course this floor has a bathroom. Nicely redone. So yeah, but this also is great again for the real estate investor. So this is why a lot of real estate investors are purchasing these properties. They are getting multiple revenue streams. They're getting revenue streams from my consumers. They're getting revenue streams from the Airbnb model. Some homes, aka me, I'm going to have a home where I'm going to be providing a daycare center is going to open up in the home, which again is another great opportunity for adults with disabilities, just social interactions, work opportunities, that supportive employment service that we can provide within our own agencies, which is just really cool. So I hope this gives you a better picture of what makes us different than a lot of other traditional home healthcare agencies. They can't provide affordable housing for the most part, and if they can, normally they are underpaying their staff. But Optonome, because it is the back office that does all the work for me and I do mostly the review process, I'm able to give my staff livable wages with the ability to earn more and to financially and also education-wise grow. That's a big deal for them. And I want to make them feel valued because they're the glue of my agency, so they should feel valued. The ability to provide a healthcare professional on a weekly basis is huge. Again, not a lot of people are doing that, as well as the affordable housing. Like, those are 3 big things that support coordinators are looking for. And I can vouch for that because I just got my agency approved. Woo! So I can provide services for autism. Just got approved yesterday. And I talked to the director and she was like, wow, we have a waiting list for people that have the services that you're talking about. So I can't wait for your agency to be up and running, because you are going to benefit so many. And it's not just me, it's again the 22 plus more agencies that are getting started in Philadelphia, as well as 13 other states getting started. So yeah, please reach out if you have more questions. I know you couldn't come here, so I wanted to bring Philly to you and show you my home and realize we're changing the world. I really feel that this is going to put home health care where it should be, where I, as an OT, literally care for my patients or for my consumers. And I'm with them for years. I get to help them for years, which is just incredible. And I cannot thank Dennis enough, and I cannot thank Optonome. And I hope that this gives you a better insight, and I hope that you're able to help us grow more, and yeah, to make this relationship an incredible one where we're changing home health care for the better. So thank you so much. Have a great day, and looking forward to talking to you guys soon.